Welcome to the official online launch of Healthy Kilkenny and celebration of Kilkenny joining the Healthy Cities and Counties network. Firstly, I would like to thank you for joining the online Healthy Kilkenny launch. The guest speakers joining us today for the launch of Healthy Kilkenny are Frank Fian, the Minister of State for Public Health, Wellbeing and the National Drug Strategy, Councillor Andrew McGuinness, the Cathaoirleach of Kilkenny County Council, and Joan Murphy, Health Promotion and Improvement, Health and Wellbeing with South East Community Healthcare. We're also joined by our local committees, the Kilkenny LCDC and Healthy Kilkenny, and our action lead partners and implementers in Kilkenny.
The aim of Healthy Kilkenny is to create a Kilkenny community where everyone can enjoy physical and mental health, where well-being is valued and supported at every level of society. We can achieve a Healthy Kilkenny by working together to respond to local priorities and address health inequalities in our communities. The Healthy Ireland vision and goals ensures that all citizens are supported and empowered to achieve health and well-being at all stages of life. This video showcases some of the Healthy Kilkenny actions outlined in the Healthy Ireland Community Plan.
I facilitate and support the development of initiatives for the Healthy Ireland funded Healthy Inclusive Communities, which will develop and expand the range of opportunities for the people to participate in sporting and physical activity. The main four areas I work in are Castlecomer, Urlingford, Callan and Kilkenny City. I work closely with sports clubs, community-based organisations and national governing bodies of sport to promote quality experiences for participation and to support their work locally. I also aim to address barriers to participation, encourage access, address health inequalities and increase opportunities for participation by those who experience a disadvantage for any reason. Some of the programmes that we have run under this initiative are Ladies Let's Move, Yoga for Men and a Couch to 3 Kilometre programme. All of our programmes are inclusive of all abilities.
The Kilkenny Social Prescribing pilot service began in July 2020 with Kilkenny Leader Partnership and is funded through Healthy Kilkenny. To date, the social prescribing service has worked with people from ages of 19 to 90 and has supported people throughout COVID-19, linking people into community-based activities and services. Social prescribing supports the health and well-being of people, connecting them to the community-based activities and services that are on their own doorstep, such as walking groups, training and employment opportunities and mental health supports. It offers people a social prescription rather than just a medical one. Social prescribing is aimed at anyone over 18 living in Kilkenny who needs some support in accessing services in their community. It can be difficult to know what is out there sometimes. It's great for people who want to take better care of their health or who might be feeling stressed or alone or struggling with chronic health conditions. Social prescribing is an evidence-based approach proven to provide unique opportunities for support. It helps build positive mental health, creates connection in communities, and helps people manage and plan their own well-being.
Within the community engagement work, I have focused on one-parent families in County Kilkenny, creating an open space for the voices of parents to share insights into their experiences, challenges and needs. Parents identified the importance of other parents with similar experience. This informal network of peers is essential for many parents for accessing information, signposting and support. Through this process, I've identified a network of parents that has created the grassroots of the Kilkenny one-parent community and the development of a peer support network, open to all parents who are parenting alone. We are supporting parents by offering peer support, building relationships with services across the county, offering training and supporting the development of specific training for peer support advocates, building their capacity within their communities to support other parents parenting alone.
In the true spirit of partnership working, here in the South East, we have come together collectively to work in partnership with the 5 local community development committees to implement key policy priority programmes across our region. These include implementation of actions and initiatives in priority areas of positive ageing, healthy eating, sexual health and tobacco.
Hi, I'm Roisin Hickey and I support a Healthy Kilkenny.
It gives me great pleasure to introduce the Cllr of Kilkenny County Council, Councillor Andrew McGuinness.
I'm delighted to be here as Chairman of Kilkenny County Council to participate in this virtual launch of the Healthy Kilkenny programme. I want to acknowledge Minister Frank Feighan's attendance, Minister of State for Public Health, Wellbeing and National Drug Strategy, and thank him for participating. I also want to acknowledge Declan Gibbons, Chair of the LCDC and the Healthy Kilkenny Committee, and all of the members of those committees who have carried out a huge amount of work to get to this point. Kilkenny County Council and all of the elected members have a significant role in protecting and promoting health and well-being in all of our communities. Our mission is to get the Healthy Ireland message into our communities, making Kilkenny a healthier place to live, work and to play. We want everyone, young and old, to feel supported in taking steps towards a healthier lifestyle. Kilkenny County Council are proud to be part of the launch of the Healthy Ireland Community Plan and to be joining the Healthy Cities and Counties network, acknowledging the importance of the community in delivering a healthy Kilkenny and ensuring nobody is left behind. A healthy Kilkenny provides opportunities for health, encouraging healthy behaviours for our families and for our communities. Multi-agency collaboration is essential in delivering the programme with the LCDC and the Healthy Kilkenny Committee. By working together in partnership, we can do more in delivering a healthy Kilkenny and strengthening connections and initiatives in our communities. It is hugely important to prioritise health and well-being in all of our local policies and future development plans. We have made a conscious effort to do this, and that has been very evident, particularly during lockdown, with the development and enhancement of many recreational spaces and public walkways. COVID has shown us just how important these spaces and activities are for both our physical and mental health. In that regard, I believe Kilkenny County Council has responded very proactively. There are many exciting developments nearing completion in Kilkenny that will encourage healthy behaviours such as the Abbey Quarter, the new Biodiversity Park, the South East Greenway, cycling and walking infrastructure, and of course the recently opened skate park that is already a huge success. Lastly, I want to point to the fantastic work that has been done since the start of the pandemic, such as the In This Together and Keep Well campaigns. The response of the Healthy Kilkenny Committee, Kilkenny County Council Community Forum and Kilkenny LCDC are great examples of working together to support the most vulnerable individuals in our communities while promoting and encouraging good health and well-being. I want to finish by thanking everyone involved in this project, particularly the LCDC and the Healthy Kilkenny Committee, and assure you that my fellow elected members and I will continue to work with you and prioritise health and well-being in all of the decisions we make as public representatives. I look forward to working with you to achieve our common goal, a healthy Kilkenny for all. Thank you.
Now I'd like to introduce the Minister of State for Public Health, Wellbeing and the National Drug Strategy, Minister Frank Feighan.
Ladies and gentlemen, I'm delighted to be with you today to mark the launch of Healthy Kilkenny and to celebrate Kilkenny joining the Healthy Cities and Counties Network. I would like to thank Jeanette Boran, Healthy Kilkenny Coordinator, and Declan Gibbons, Chair of the Healthy Kilkenny Committee, for the kind invitation to share this special occasion with you today. This past year has been a challenging one for all of us, and the importance of health and well-being and promotion of resilience has never been so much at the forefront of all our lives. At Healthy Ireland, we want to ensure that everyone, especially those at the margins of society, gets the opportunity to improve their own health and well-being and to develop their resilience. But to do that, we need to provide the tools and support to make the healthy choice the easy choice. In order to achieve this, we need the commitment of every sector of society to play their part. Good health and well-being is a product of so many factors and requires collaboration across public, private, community and voluntary sector organisations, and empowering them to work together to cultivate change. This would not be possible without the involvement of every local authority in Ireland, and particularly the local community development committees, who are ideal partners who support and implement Healthy Ireland in response to local people's needs. Looking at your current work programme, I very much welcome the actions around community engagement and building healthy, inclusive communities. This is a great example of local people coming together to address local needs and is at the heart of what Healthy Counties is about, ensuring that those in disadvantaged areas who can be harder to reach are included and prioritised is one of the key aims of Healthy Ireland. I've been involved with a few Healthy City and Counties launches since becoming Minister, and I'm always struck by the determination and the drive of those of you who seek to make Healthy Ireland a reality and who strive to improve the health and well-being of the people in your area. It is so heartening to see the progress being made by groups involved with the Healthy Cities and Counties networks, and groups like Healthy Kilkenny do the actual work of joining up government policies like Healthy Ireland with their own local economic and community plans. The Healthy Cities and Counties of Ireland network, they provide a key structure and platform to support local communities and was instrumental in delivering the government's Resilience and Recovery Plan for living with COVID-19, especially as part of our Keep Well campaign. The aim of the network is to support you in your work to implement your own healthy county plans, provide the training, expertise and support that you need. The network will continue to strengthen the links that are so important for our work, the links between our healthy cities and counties and the links between national policies and local implementation. And I am delighted to welcome Healthy Kilkenny to the membership of the network today. We are currently in the process of developing a strategy for the network, following a process of public consultations with many stakeholders, as well as regional workshops. This feedback is now being considered by the National Network Committee, and I hope to be publishing the strategy in the autumn. I want to offer my sincere congratulations and thanks to all involved, to the Healthy Kilkenny Committee, especially their Chair Declan Gibbons, for your dedication, hard work and perseverance during these challenging times. And I look forward to hearing about your progress in the months and years to come. Thank you.
purpose of Kilkenny LCDC is to promote and support economic, local and community development through greater integration in the planning of and the delivery of local and community development services and interventions. The Kilkenny LCDC works to improve health and well-being by creating and improving the physical and social environment and developing community resources that help people support each other. The Healthy Ireland approach to health and well-being recognises the need to work in collaboration across public, private, voluntary and community sector organisations. Our local Healthy Ireland community plan seeks to reduce health inequalities and emphasises the need to empower people and communities to look after their health and well-being. The community's approach to health and well-being can reduce health inequalities by addressing the social determinants of health, for instance where we live, our environment, our genetics, our income and education level, and our relationships with families and friends. Today we celebrate joining the Healthy Cities and Counties network and showcase some of the great initiatives that are being implemented in Kilkenny. Despite the COVID-19 pandemic, Healthy Kilkenny made good progress in implementing the actions identified in the Healthy Kilkenny Community Plan, with significant support from our lead partners and communities. The Healthy Ireland Community Plan highlights local concerns and priorities across other local policies, the LECP, Kilkenny Age Friendly County Strategy, South East Traveller Health Unit, KRSP and Connecting for Life. The priority areas addressed in the Healthy Kilkenny Community Plan align with the National Healthy Ireland priority areas: physical activity, tobacco, mental health, alcohol, healthy weight, sexual health and spaces and places for health and well-being. Already, we're implementing 4 of the priority areas in the plan. Firstly, cross-cutting actions. Under this strategy area, Healthy Kilkenny is implementing a community engagement programme and an initiative for Kilkenny one-parent families, which includes developing accessible resources and information. In response to COVID-19, the HSE and 5 LCDCs in the South East region worked together to provide care packs, including essential items and information to vulnerable people who were cocooning. A community engagement facilitator is working with community services for people affected by domestic violence, people with disabilities. Kilkenny One-Parent Families, a peer support network for Kilkenny One-Parent Families, has been set up and are encouraging in actions around training and education, resources, information and awareness, accessing services and peer support signposting. Secondly, physical activity, healthy inclusive communities. The delivery of physical activity programmes for adults and young people living in disadvantaged areas, including people with disabilities or chronic illness and the travelling community. During COVID-19 restrictions, the physical activity programme moved online. For example, Couch to 3K, Ladies Let's Move, Men's Yoga. The health and wellbeing impact of these programmes has been essential during restrictions as they motivated people in our communities to engage and participate in regular physical activity. Thirdly, regional actions. The regional actions focus on partnership, working and shared learning across the South East region with the LCDCs, CIPSEs and the HSE. The regional actions focus on positive ageing, healthy eating and tobacco. Collectively, these actions empower our citizens to be healthy at all stages of life by providing essential information, encouraging healthy behaviours and enhancing resilience in our communities. The shared learning partnership, working from all the stakeholders involved, strengthens our actions and has a positive impact across the South East. And fourth, mental health and wellbeing, social prescribing and the small grant scheme. Kilkenny Leader Partnership are leading out a social prescribing project in Kilkenny. Social prescribing is the bridge between medical and social models of health and tackles loneliness and isolation by creating a link between the client and voluntary and community services. Now, more than ever, this service has been essential for people in our communities, especially for those who are living alone with little social supports around them. The Kilkenny Social Prescribing Service has been linking people to supports in their community, including access to digital devices to enable them to connect and engage with the world around them. Under the Healthy Ireland Community Mental Health Fund, a small grant scheme was made available and 8 mental health evidence-based initiatives were approved by the Kilkenny LCDC. These initiatives include social farming placements in Kilkenny for people seeking to learn new skills, including people living with disabilities, mental health evidence-based programmes for young people, wellbeing activities and workshops for the LGBTI community, creative arts programme for community groups to increase awareness about domestic violence, community arts and outdoor programmes to encourage well-being, resilience and learn new skills in the natural environment. A Wellbeing initiative to increase the awareness of self-care programmes to family members in Kilkenny City and County who are affected by problem substance use in their family. A mental health arts initiative for young people, enabling them with the skills to build resilience and self-confidence and enhance their health and well-being. Resources to increase awareness about mental health supports and signposting that are available in Kilkenny City and County. I'm delighted to introduce Joan Murphy, Health Promotion and Improvement, Health and Wellbeing from South East Community Healthcare.
DIAGWIT, launched in 2013, the Healthy Ireland framework provided for the first time a cross-government focus to deliver the vision for a healthy Ireland. This vision seeks to create a society where everyone can enjoy physical and mental health and well-being to their full potential, where well-being is valued and supported at every level of society and is everyone's responsibility. As well as 14 government departments involved in Healthy Ireland, the cross-society approach also includes all Ireland institutions, local authorities, public bodies, academia, schools and education institutions, sports, cultural, creative and voluntary groups. Healthy Ireland has at its core 4 high-level goals. These goals highlight the lifelong approach required to promote health and well-being, as well as focusing on the social determinants of health to prevent and reduce health inequalities. These goals also seek to protect the public from threats to health and well-being, and to create an environment where every individual and sector of society can play their part in achieving a healthy Ireland. The Healthy Ireland framework identifies priority areas across a range of health behaviours, including physical activity, obesity, alcohol, smoking, sexual health, skin cancer, and spaces and places for health and well-being. In the South East, Healthy Ireland is implemented across the 5 counties of Carlow, Kilkenny, Tipperary, Waterford and Wexford. And each of these counties have developed their own Healthy Ireland county plan. In the true spirit of partnership working, here in the South East, we have come together collectively to work in partnership with the 5 local community development committees to implement key policy priority programmes across our region. These include implementation of actions and initiatives in priority areas of positive ageing, healthy eating, sexual health and tobacco. Under the Positive Ageing Action, in 2019, we held a good practice seminar that brought each of the 5 counties together to highlight the positive ageing initiatives that are implementing in their county. The seminar also provided a wonderful opportunity to share the learnings from these positive ageing initiatives. In 2020, as part of Positive Ageing Week, the HSE, the Regional Age Friendly Alliance and the local authorities delivered a series of positive ageing online webinars that were informative, educational and fun. The content included 3 categories: health and well-being, information and culture and diversity. Under the Healthy Eating Action, the HSE Healthy Food Made Easy programme was rolled out across the South East region. The Healthy Food Made Easy programme is a 6-week nutrition and cooking skills programme delivered by trained leaders in communities and schools. Leaders are trained and supported to deliver the programme by HSE community dietitians, and various groups are taught essential cooking skills as well as valuable healthy eating advice. In 2019 and again in 2020, new tutors were trained across the region to roll out this programme. In response to the COVID-19 pandemic, the Healthy Food Made Easy programme moved to an online platform, and here in Kilkenny, we continue to deliver this programme to young people and families. Positive outcomes from participating in this programme include increase in fruit and vegetable intake, improvement in cooking self-efficacy, improvement in nutritional knowledge, a reduction in takeaway intake, and increased variety of food consumed following participation. Under the Sexual Health Action, a one-day seminar was organised in 2018, which facilitated the exploration of best practice in relation to sexual health and created awareness of the sexual health services and supports available across the region. This was a very enjoyable seminar and provided a great opportunity for the sharing and showcasing of the valuable work happening in our region, and also facilitating networking and information sharing with services. With regard to the tobacco-free action, the Healthy Ireland framework specifically references towards a tobacco-free society as one of the existing targets for improving health and well-being. In 2017, a regional tobacco-free action plan was agreed, and a range of actions and initiatives for young people in out-of-school settings were identified and implemented. In 2018 and again in 2019, the Exhale programme was delivered to youth organisations across the region. This programme was delivered in partnership with the Irish Cancer Society. In addition, a tobacco-free positive messaging campaign was also run with young people. And this included the delivery of a number of video making workshops organised by the Irish Cancer Society and the rollout of a regional poster competition. In 2020, a bespoke, strong, not tough, resilience programme was rolled out to tutors working in the out-of-school setting. This programme supports young people's emotional resilience and continues to be rolled out across our region again in 2021. As we look ahead and to the continued implementation of Healthy Ireland here in Kilkenny, we can be very proud of the achievements we have made to date. We can take heart in the knowledge that our county is 100% committed to promoting health and well-being for all that live, work and play in Kilkenny. Leanar aig agus cuidiú len an Jan Ibra, go raibh míle maith agat.
I'd like to acknowledge the work of my colleagues on the Healthy Kilkenny Committee and Kilkenny LCDC, particularly the previous chairs Colette Byrne, Anne Corr and Fergus Keane. I would particularly like to acknowledge Lindsay Butler of Kilkenny County Council for her involvement in the Healthy Ireland programme. I would also like to acknowledge the lead partners, Kilkenny Leader Partnership, Kilkenny Recreation and Sports Partnership, the HSE and Kilkenny County Council. Finally, I would like to thank the Healthy Ireland National Network and Pobble for their ongoing support of Healthy Kilkenny. Thank you for watching. We look forward to delivering on the rest of the priorities in the Healthy Kilkenny plan.